Welcome to the Living Ageless and Bold podcast. Each episode, I bring you amazing women who inspire, educate, and share their experiences and journeys along the way. So grab a glass of wine or a cup of coffee, find a cozy spot, and let's relax and have some fun hearing what can be accomplished after 55. Hi, everybody. All right, today we are going to talk all things medical issues for women over 50. And I am selfishly doing this. I just got a lot of horrible blood work back. And my guest today is a client, and she's become a friend. She is a triple board certified physician. She's an OBGYN. She owns a wellness center, Merak Wellness. And her passion is basically taking women through the childbearing years to menopause and not being ashamed of the things that are happening to our bodies and opening conversations that people haven't had, that we've had secretly in a back closet, in a back room with our girlfriends, but being able to talk about the things that are happening and then not believing everything we're reading, that this is normal, that we have to live this way. So Pushpinder Dhillon, welcome to the show. And I don't even know where we're going to start with this.
Thank you, Christina.
So, and you go through the process, and we all think, and we've had this conversation that these are the things that just happen. You have a baby, these issues happen. You hit menopause, these issues happen. But what you've been saying and what we're really trying to spread the word about is that it's not cookie cutter like that. It doesn't have to be that way. We can prevent things from happening. So kind of take us through after we have our babies and what our body's doing to where we are now.
Great. That's a very wide question. And I've spent 20 years doing that. So I will try to put it in few sentences. A woman's body goes through a lot of changes. And I always say the most initial changes we notice is after we have our baby or babies. Because before that, you're young, your hormones are perfect, you're in great shape, your muscles, your bones are strong. But after a woman goes through pregnancy, almost everything in our body changes. So if you look at the scientific studies, they will tell you that a woman's body will never be the same. During 9 months of pregnancy, she is using everything she has to nourish that embryo and then fetus, and we call it a baby after birth. And it takes a lot of energy from her. So studies also show that women, after they are 30, their bone mass starts to go down. And as women age, as we are taking care of the baby, there is a lot of stress, from childhood to teenage and then later and forever. And for that stress definitely has a lot of impacts on a woman's body. So one of the organs I always like to talk about is pelvic health. Once a woman has carried a baby or delivered, whether it's a normal delivery or C-section, her pelvis is not the same. But as we age, if the woman is unable to continue her diet and her exercise, it changes her weight, it changes her bone health, it changes her skin, her hair. So basically, everything is going through a change, and we can talk about each system, whatever you would like to start with.
Yeah. So we've had our babies, and, we're in our 50s, and I was actually just with some girlfriends this weekend, and they're like hitting menopause and their cholesterol numbers have gone through the roof. So, and the doctors are saying, and I'm getting frustrated. We've had this conversation that, when you get to menopause, this is just what happens. We need to put you on medicine. You enter menopause, your cholesterol goes to the roof, and we're going to put you on medicine to take care of it. But is that really true? Is it menopause causes cholesterol to increase?
It is actually true. So the hormones that our body, a woman's body, estrogen and progesterone, some of these hormones are actually what we call it cardioprotective. That means they protect our heart health. Also, as soon as we hit menopause, definitely risk of cardiac disease or heart disease goes up. And cholesterol is related to heart disease. Why do we worry about our cholesterol so much, right? We all want to have good cholesterol. Why? Because what happens when the cholesterol goes up? That means there is, in simple term, there is more fat cells floating around in your blood, in your circulatory system. So these fat cells can accumulate into the little vessels in the heart, which we call coronary arteries. Now, as the fat accumulates there, that can clog these arteries and call what we call as doctors coronary heart disease. Basically, the blood vessels of the heart are clotting, which can lead to cardiac disease and eventually cardiac arrest and death. So it is very dangerous. But as woman gets older, definitely the cholesterol gets higher, and menopause is that one tipping point after which we do see very high cholesterol in women.
So not fair.
That's right. Well, definitely. Now, I tell my patients that all the time, that until menopause, we are ahead of men. But as soon as menopause hits, we definitely catch up.
So most of the women listening are over 50 and are going through this. And we've had this discussion. I feel great. I feel healthy. I work out every day. I eat really well. And, my numbers are through the roof. So what can we do if we can't stop it, if menopause is going to make this happen, what is it that we can do to maybe slow it down a little bit, get our numbers down naturally? And I guess if we have to take medicine, we have to take medicine, right?
Absolutely. But medicine, like I told you, medicine is not the initial step that I recommend my patients, especially if a woman is healthy, her weight is normal, she doesn't have diabetes, then we may not need to jump on medications right away. Yes, medications are very important. They work very well. But what are the things a woman can do? I will always start with first diet and exercise. Exercise is so important. And whenever we say exercise, women always think, I don't have time to go to the gym. Most of us don't. And that's okay. As long as she's able to do 2 to 3 times a week cardio exercise for at least 20 minutes and weight-bearing exercises. Weight-bearing exercises are important for weight management. It's easy to lose weight, but then to maintain weight is very important. And weight and cholesterol and cardiac health and diabetes, these are all interrelated. So losing weight is very important. What studies have shown that to get the benefit of cardiac health, we need to lose at least 10% of our ideal body weight. So ideal body weight is easy to find out. You can Google search it and it can tell you what's your ideal body weight. So to reach their 10% of ideal body weight. Other things we want to think about is nutrition. Nutrition is very important. When I say nutrition, you want to cut down on your fat. So anything which is fatty foods, we want to cut that down. Increasing protein, very important diet. So taking high protein diet, exercise, those will be the 2 most important things to control cholesterol.
So you talk about protein. Everybody talks about protein, but we need to stay away from red meat. And then you want to stay away from fats. And then do you eat the salad? I love a salad, but am I better off just eating a grilled chicken breast because of the protein than, and I'm sure we should have a nutritionist on too. But it's so hard and it's so confusing. What are the best choices to make to be heart healthy?
So definitely lean meats. Like you said, chicken breast is great. Fish or seafood is another great choice. For women who are vegetarian, a lot of my patients are vegetarian these days. So if you're a vegetarian, there are a lot of vegetarian choices. For example, chickpeas, hummus. If a patient is able to take dairy, if they're not completely vegan, low-fat yogurt, low-fat cheese, all of those are very good choices. And nuts, don't forget, nuts are very high and they increase the good cholesterol, which we call HDL. So HDL is a healthy cholesterol, which is important for the heart health. So to increase that, any type of nuts, whatever is your favorite nut, peanuts, almonds, cashews, any nuts, that's very healthy.
But aren't they high in fat?
They are definitely high in fat, but it's a good fat. So nuts, if you look at the Mediterranean diet, which is high in nuts, it still is okay for your cholesterol because what we are doing is we're increasing the HDL, which is the good cholesterol. When you look at the cholesterol, what we want to lower is total cholesterol and something called LDL, which is the bad cholesterol. But HDL, which is the good cholesterol, is actually protective for your heart. So we always want to, women usually tend to have higher HDL as compared to men, especially in the premenopausal states. So nut cholesterol or nut fat is not bad for you.
Interesting. So what if you have high cholesterol, but you also have really high good cholesterol? Does that balance it out?
It sort of balances out. So there are actually, you can talk to a cardiologist and they have these calculations where they look at what are your risk to actually have a heart attack. Like I told you earlier, why we are always chasing cholesterol. The whole reason for that is we are trying to have a cardioprotective effect. So definitely if a patient comes in and her cholesterol is abnormal, but her good cholesterol is very high, that's very good actually. So her risk of having a heart attack or a heart disease is lower than a patient who actually not only has high bad cholesterol, but very low good cholesterol.
Okay, so what else over 50 do we need to start concentrating on? I know we definitely want to work out with weights to get our bones. Bone health is really important.
Bone health is very important, and also weight-bearing exercises is important for healthy core. Because as when women get from 50 to 60 to 70, important thing is the balance becomes an issue. And if you look at older women, they have osteoporosis. If you look at women in their 60s and 70s, they're at very high risk for fractures, the most common being the femoral fracture or the femur. So what we want their bones to be healthy, but at the same time, we want their muscle and their core to be strong. So they have better balance, especially women who are living by themselves. At night, when you turn the lights on, you have to safely make it to the bathroom. And if your core and your rest of your body, your muscles are not strong, there is a higher chance of imbalance. So because of imbalance, if a woman falls and her the scores we talk about, which is, I won't bore you with all the medical terms, but the bone strength that we check with the DEXA scans, if those scan already shows that her bones are weak and now she has imbalance because of not healthy core or leg muscles, she's at increased risk for fall. So exercise, weight-bearing exercise is important for that. As women get older, risk of urinary incontinence goes up. After childbirth, as I said, our pelvic floor is not the same. So a lot of women will tell you they have to cross their legs when they cough or they sneeze or they laugh with their friends. So core exercises are shown to actually have benefits for pelvic health, so that she can live her life normally, so she can go out with her friends, she can go play golf, she can go running and not having to wear a panty liner or a pad. So those are important things for her exercise. Other thing is stress and sleep hygiene. Very important. If a patient, and I know we all have stress, but there are ways to manage stress. Stress management is important because if a woman or any patient, if they're stressed, they have hormones in their body which are not, I will say, not good hormones, such as cortisol. So when this hormone is high, it leads to a lot of problems with the health, such as diabetes. So, high cortisol, glucose intolerance, patient has diabetes. Patient has diabetes, higher risk for having high cholesterol. High cholesterol, diabetes combined together, high risk of heart disease. So it's all the systems are interrelated. So definitely stress reduction is important. Sleep hygiene, studies, even when I talk patients about my weight management patients, and I always tell them sleep is very important. Studies actually show that people who are not able to get at least 7 hours of healthy sleep at night have high chance of not only heart disease, obesity, and mental issues or psychiatric disorders. They can have high cholesterol problems. So all of this is interrelated. Exercise to stress relief, definitely whatever she likes to enjoy. I tell always every day to my patients in the office, how is stress relief? It's different for everyone. For somebody, it's listening to music. For somebody, it's going out on a walk. For somebody, it's meditation. But whatever it takes, your stress relief is important. not only for your mental health, but your overall physical health, and basically affects every system in your body.
I have lots of follow-up questions. You said healthy sleep, 7 hours of healthy sleep. What does that mean when you have to get up in the middle of the night once or twice to use the restroom? Does that mess up? Does it have to be 7 straight hours?
Ideally 7 straight hours, but you definitely know as we get older, it's not easy to fall back in the bed and fall asleep right away, right? It's not like when you're 18, you hit the bed and you're asleep. So definitely these things affect your sleep hygiene. That's why it's important to have a good pelvic health. So you're not getting up every 2 hours to go to the bathroom. A woman should not need that. She should be able to sleep 7 hours without getting up. Sleep hygiene, one day somebody goes to bed at 10:30, the other day she's going to bed at midnight. So that's not good, because humans, we like habits. So our body likes to go on the clock. So it's always good to have the sleep hygiene. Always good to have a late evening snack. I won't call it bedtime snack, but eating dinner early, like no later than 5 to 6 p.m. And then an hour before your bedtime, having a high protein healthy snack, because that gives your body enough nutrition overnight. High protein regulates your metabolism overnight. So your body has enough fuel and healthy fuel overnight. So you are actually getting a good night's sleep. And it's good for the management of your diabetes. I have been managing diabetes for almost 18 years now. And I can tell you one thing which really helps my patients to have a good fasting glucose control is 10 to 15 minute exercise after dinner. And it doesn't have to be strenuous exercise, simple walking. And then eating a high protein snack at bedtime. So having enough food in your tummy that you're not too full, and having a healthy pelvic health so you don't have to get up and urinate all the time. And that exercise in the evening, not immediately before bed, but few hours before bed, all of this can help you to have a healthy 7 hours good night's sleep.
Okay, so let's talk about intermittent fasting, which a lot of my friends are doing. My husband does it. I just started doing it because his cholesterol went down 40 points when he started doing that. So again, you could read everything, every different direction. And I've heard there's another program where you're supposed to eat like 8 almonds before you go to bed so that your body is doing that. Which is better? Is it better to eat the protein before you go to bed, or is it better to not have anything for 16 hours and let your body, get rid of all the gunk in there?
So if you look at the data, prolonged fasting definitely has a role. What I think it has a big role in weight management. But I'm a believer of long-term health. I can easily help a patient lose 20% of her body weight, but then 6 months she's going to gain it back, right? Did I do a good job? I don't think so, because my goal is to have a long-term health benefits. So intermittent fasting, definitely very good as a jump start. Like you said, your husband was able to lose 40 pounds. I see this all the time.
His cholesterol went down 40 points.
Oh, his cholesterol went down 40 points. Mm-hmm. Yes, definitely. So I do see immediate results with prolonged fasting or intermittent fasting, whether it's, weight loss or help with the labs, that patients' labs look better. But with the long term, I believe that eating a nutritious diet, frequent small meals are much better to have a long-term healthy maintained weight and healthy cholesterol and heart health and diabetes.
How do you define a small meal? The 6 meals a day. I used to do that, but
yes.
Then it's how much do you eat at each of those 6 meals a day?
So if you look at ours, I actually have a full nutrition plan for my patients. If you come to our office, you will see that. And it actually, what we do is we do 3 meals and 3 snacks. So a patient eats breakfast, lunch, and dinner. Between breakfast and lunch, she has a snack. Between lunch and dinner, she has a snack. And then she has what we call it a bedtime snack. It's not like bedtime, but an hour before bedtime. The key with the diet all these nutrition plans, especially what I follow is what you eat. So high protein, low carb, but I did not say no carb, complex carbs. So for example, in the morning, if she has 2 egg whites, with that, a whole wheat toast. Now on that, if she wants to add an avocado or a piece of low fat cheese, even better. So that will be her breakfast. We usually say the carb count, you want to keep your carb count about 25. And once again, very important, quality of carb matters, because a piece of white bread and a piece of whole wheat bread may not have a big difference in carbs, but if you give your body a piece of white bread or mac and cheese, what happens as soon as it goes into the stomach, your insulin surge goes up, shooting up. So your glucose goes shooting up. But soon enough, it's going to be getting chewed up, and then sugar drops. So the patient feels like she doesn't want to do anything. She doesn't want to go to the gym. She just wants to lay on that couch after, having a big meal, because it happens to me if I have a carb at my lunch. But then when you're eating your snack, the snack always should be high in protein and very low in carbs. You will rarely see a patient gaining weight or her cholesterol going up, or I can assure you her diabetes will get really, really well controlled if she follows this frequent meals, 3 meals and 3 snacks. So the key with the snacks is high protein snack with very low amount of carb, and the carb should be low in low sugar carb, like not simple carb, but complex carb. For example, bedtime snack, an apple with the peanut butter, great snack. A cup of plain Greek yogurt with some fresh fruit, or if it's winter, some frozen berries in it. And now if she wants to put a little bit granola in it, that's great. Oats or granola, which are whole grains, those are also good for cholesterol, for diabetes, and for weight management.
So you say apple and peanut butter, but it's probably not Jif or Skippy. Should be getting organic, sugar-free.
Yeah. So actually, if you look at the data, that's a whole another talk we can talk about, organic versus inorganic, right? Or non-organic. I don't tell my patients they have to go to the aisle and buy the most expensive organic, certain brand peanut butter. Jiffy's will do just fine. So any peanut butter that they have will be just fine, because we don't actually see a lot of data in our day-to-day medicine that how much non-genetically engineered or non-organic food affects. Yes, it has a role maybe in other diseases such as connective tissue disorders or lupus patients. But as per heart health or cholesterol or diabetes, any peanut butter will do just fine. Of course, if you can, afford organic or some special kind, I'm sure they taste really good.
Yeah. If I can just have my Jif, I'm very happy. That's great. And I have to tell, I've told all my friends this. Oh, you do? Okay, even better.
Yes.
Board certified approved Jif peanut butter. But you told me, and I love this, and I've told all my friends, is the hummus with the wheat pita. So you cut up the pita into the triangles. Then I peel them open so they look like tortilla chips, and you toast them. And I just put it in a Tupperware container. It's delicious. It's good, and it's healthy. Yay.
It is very good. I keep it on my dining table because when I'm at work, I make those pita chips on the weekend. I put it in little Ziploc bags. I keep it on the table. So when kids come home from school, instead of them grabbing an Oreo cookie or something, they have it right there. It's easy. They open their little hummus container and they have that with some fresh, veggies, cucumbers or sweet peppers. They love those. So those little changes in life can make a huge difference.
Yeah, it's amazing. Let's talk about fruit, because fruit has sugar. So if you have issues with diabetes or high glucose levels, yes or no to fruit?
So fruit, you have to look at the glycemic index of the fruit. That means there are fruits which are high in sugar. Easy way to remember is tropical fruits, usually pineapples, mangoes, papayas. Those are high in carb. Those are high in sugar. So if you're a diabetic, you probably want to stay away from mango, even though they're delicious. But you want to stay away from them. Same is for pineapple and papaya. Now, grapes and oranges, they're not considered tropical fruits, but they're still high in carbs. So that's why I tell my diabetic patients or my weight management patients not to have too much juice, any juice, orange juice, apple juice. But then there are fruits which are low in sugar, such as berries. Berries are great. Apples are great. Banana is a fruit where the sugar content goes up as this fruit ripes. So if you're like me and you like those yellow-green bananas, those are great. They're high in potassium. They're very healthy fruit. You put a little bit of peanut butter on it, even better. Yes. But stay away from tropical fruits. Stay away from oranges and grapes. Grapes are actually not healthy at all. They don't have much nutritional values.
My favorite fruit. I love grapes. Oh.
Yes. Many of my pregnant patients love grapes, and many of my weight management patients love grapes. But I tell them, if you really want to see how many grapes you want to have, let's say you have a snack and you want to have cheese and grapes. You ready for this?
I don't know. Go ahead.
8 to 9 grapes. Probably a 2-year-old can 8 or 9 grapes. So that's all you are allowed for your snack if you're trying to be heart healthy, diabetes healthy, or you're trying to lose weight.
Okay. What about watermelon? That's probably fine.
Watermelon is high. Watermelon is high in sugar. High in sugar.
Pushpinder. Yes.
I'm sorry.
All right. Apples it is. Okay. Let's talk about, because I don't take any vitamins. I don't take any supplements. I'm not a big pill person, medicine person. Obviously, there are things we should be taking. And I've been reading a lot about magnesium. So I'd love to hear your perspective on, women over 50. What are some things that are musts, maybes, and things to stay away from?
So vitamins definitely have a role. If we lived in a perfect environment where we all ate a perfect diet, we went for a walk in a nice sunny day with, of course, sunscreen on, then we don't need any supplements. But unfortunately, our diet is not perfect, no matter how much we try. So I definitely recommend a woman's vitamin. Any brand, any quality works just fine. So woman's vitamin is very good. Magnesium, you asked me. So magnesium has a role. Not everyone needs to take magnesium every day, but most of us will have some aches and pains and, as we get older. So magnesium definitely helps with the stiffness. Magnesium also helps with patients. I see a lot of women after 50s when they're having difficulty with bowel movement. So magnesium is a very mild stool softener in a way. So it helps you to have a normal bowel movements. I tell patients you can take magnesium, but if it's giving you a little bit of diarrhea, you don't take it every day, maybe 2 to 3 times a week. Vitamin D, very, very important. As women over 50, I tell them at least, 1,000 units of vitamin D every day. Vitamin D is one thing. Yes, vitamin D is one thing which I actually recommend patients do get checked. It's a very simple blood test, and patients or women who are mostly working inside, many of us, we are on our computers, we are working indoors, our sun exposure, especially in Virginia, we don't get much sun, almost 6 months out of a year. So our vitamin D production or metabolism is not that good. Studies also show as we get older, because your skin is very important. You get the sunlight, your skin is very important to metabolize everything and to convert it into vitamin D. As we get older, our skin loses that capability. So vitamin D deficiency is very common. So vitamin D supplementation is important. Other supplements I highly recommend is calcium. So as women get older, not many of us, we are not big on how much calcium is in our diet, especially women who have lactose intolerance. They may not be taking dairy products that much. So calcium, vitamin D, magnesium is important, not as much as calcium and vitamin D. And now there is more and more studies that probiotics we knew that were important for your gut health. But recently, our Menopause Society has told us that there are studies which show that probiotics might have some benefit for our bone health. So probiotics are very important. My son recently, teenager, had a lot of GI issues. We saw a local gastroenterologist. We went through a big workup and everything was normal, but he still continued to have that. All I did is I started him on, I'm like, buddy, nothing else is working. Let's see, maybe it's your nerves because of the high school stress and all that. So I just started to make sure every day he's going to have 1 cup of yogurt, and he loves yogurt. And here we are, 1 month, completely asymptomatic. So I was talking to a friend who's a gastroenterologist, and what she said, we see this in teenagers. She said, I see patients who you take care of, women after menopause who have a lot of GI symptoms. So probiotics are very good at any age, but especially after menopause, they're important for your gut health, they're important for your bone health. And taking a 1 everyday vitamin for women over 50 is a very good thing.
Okay, so as we wrap up, if you were going to give our listeners 1 or 2 tips of what they just really should do post 50 to get healthy, what would be your top 2 recommendations?
My most important and favorite is self-care. We as a woman, we lose ourselves. I am a proud mom. I love what I do. But at the same time, the most important thing to all your listeners is please take every day 15 to 20 minutes for yourself. This is your time to de-stress. Do whatever you love to do. Go out for a walk. Go for a meditation. Go out with your friends. Don't drink too much wine at that time because that may not be good for your health. But a little bit of wine is good. And secondly, exercise and nutrition. If you can maintain at least 15 to 20 minutes every day for exercise, and I recommend doing 1 day cardio, next day weight bearing, and you don't have to go to the gym, something simple in your house. That will be great. And stay away from high carb food. I know everyone teaches high fat, and I think we as a society are doing very good but staying away from fat. But the sugars and the carbs is the biggest problem. Currently, 40% of our population in our country is overweight. And that's very scary. So having a healthy weight and healthy bones and your muscles is going to take care of your cardiac health, your diabetes, your cholesterol. So those will be my 2 important things to talk to your listeners.
Awesome. Thank you. And I'm sure there's a lot of information, Merak Wellness Center. If you're in the DMV, go see Pushpinder. She is amazing. Pushpinder Dhillon, thank you so much for joining me.
Thank you, Christina. It was a pleasure.
Thank you for listening or for watching this episode of Living Ageless and Bold. If you haven't already, please make sure you hit subscribe. And if you like the episode, I hope that you will give us a great review. You can also head over to livingagelessandbold.com and sign up for information, inspiration, and exclusive opportunities for us, women over 55. Thanks for listening. And remember, no matter what you do, keep living ageless and bold.